Hi, I'm Lindsay Kroner again, and I'm back to discuss another topic, preparing for your IVF cycle. So the first component of preparing for your IVF cycle is just general preconception, counseling, and preparation. In general, we like all patients to be on prenatal vitamins prior to conception. We perform basic immunity screening, testing for diseases such as rubella and varicella, which is chickenpox, to make sure that you're immune to those, or the patients are immune to those diseases. We also offer genetic carrier screening. That's basically screening for recessively inherited genetic disorders such as cystic fibrosis. And this is important because if both a patient and their partner carry mutations for one of these diseases, their child has a 25% chance of being affected. And then we just want to make sure that in general, your health screening, so routine gynecologic care and sort of routine metabolic testing is up to date. So we want to, make sure that weight is optimized, there's no pre-diabetes present, pap smear's up to date, all of those sort of general health components. Next is the female pre-screening part of the infertility workup prior to IVF. We recommend, or actually we require, infectious disease screening for all patients going through IVF. This is actually state mandated, and it includes screening for HIV, hepatitis B, hepatitis C, syphilis, and human T lymphocyte virus. Next, we perform ovarian reserve testing, and this is where we can test actually the quantity of eggs in the ovary. It doesn't really tell us anything about the quality of the eggs, which is most tightly tied to maternal age, but it does tell us about the quantity of eggs we could expect to get after an IVF stimulation. The three main ways of testing this are labs on the third day of your period, an FSH, or follicle stimulating hormone, and an estradiol. An antral follicle count, which is depicted here, so you can see a picture of the ovary, and these black circles are actually small follicles that each hold an egg. And then an anti-Müllerian hormone level. And that's just another biochemical measure of ovarian reserve, or the quantity of resting follicles. The exact testing you will get will depend on your particular provider. Next, we perform evaluation of the uterine cavity. And this is to make sure there aren't any anatomical defects, such as a fibroid or a polyp, that could negatively impact implantation. And then lastly, we perform a trial embryo transfer, and that's where we pass a catheter through the cervix into the uterus. And we just want to make sure that we're able to do that without difficulty before the time of the actual embryo transfer. So right here is actually a picture depicting a trial embryo transfer. Here you can see the cervix and the uterus, and then this white catheter is basically passed through the cervix into the uterine cavity. And we just want to make sure that we're able to do that easily and without too much difficulty. Here we see a couple of pictures depicting uterine cavity evaluation. So here you can see a saline sonogram, and that's where we actually use a small catheter and inject saline into the uterine cavity. And we use that to distend the cavity while we do an ultrasound. So the cavity actually is this black area filled with saline. And this is a good study because it allows us to see if there's any anatomic defects that are actually affecting the uterine cavity. And then on this side, we can actually see a hysterosalpingogram. And that's where we inject radio-opaque dye. That's the white dye that's actually filling the inside of the uterus and the tubes. And we take x-rays while we inject that dye. It lets us know the shape of the uterine cavity, and also will tell us if the fallopian tubes are open to the pelvic cavity. And then the last component of preparing for your IVF cycle is the male pre-screening aspect. So men actually play a really important role in infertility and contribute to about 20 to 40% of infertility. Their workup consists of the same infectious disease mandated screening that's required for women. And then additionally, we always perform a semen analysis. A semen analysis looks at the concentration of sperm, the motility of the sperm, so how well they're able to move, and then the morphology, or the shape of the sperm. And if we see an abnormality in those parameters, there may be an indication for ICSI, which is intracytoplasmic sperm injection, as I have discussed earlier, where we inject a single sperm into an egg, and that can overcome much of male infertility.